Welcome to rePROs Fight Back, a podcast where we explore all things reproductive health, rights, and justice. I'm your host, Jenny Wetter, and I'll be helping you stay informed around issues like birth control, abortion, sex education, and LGBTQ issues, and much, much more. Giving you the tools you need to take action and fight back. Okay, let's dive in. Hi, rePROs. How's everybody doing? I'm your host, Jenny Wetter, and my pronouns are she and her. So, y'all, I don't know about you, but I am still pretty furious, to be frank, about the Texas law being allowed to go into place. It is just infuriating that the Supreme Court let this happen. I am just utterly heartbroken for the people of Texas who need abortion care and are no longer able to get one. I'm recording this on September 2nd with the hope of maybe taking some downtime this weekend and, not having to focus on all of this as much. I think with the court decision, that kind of changes everything. But, hopefully I can step away for my mental health. But today, what I am thinking of is the people who had an appointment today to get an abortion and are no longer able to get one. It's not so simple to say, well, they can just go to another state to access the care they want. Clinics in other states can't handle this kind of overload for all the people in Texas to come and try and get care. And then that's only for the people who are able to travel, right? You're talking about people having, I think they said the average now is 227 miles, having to travel 227 miles to get basic health care. And what does that mean for people? That's a long trip. Many of them will need to find childcare, take days off of work. This is an insurmountable barrier for so many people. This is just devastating to so many. And I worry a little bit that we're losing sight of that. The media, hasn't been doing a great job covering this, right? They are not covering it as what it is, which is the Supreme Court basically overturning Roe v. Wade. Roe v. Wade said that you had a right to an abortion through viability. And this is completely flies in the face of that, right? A 6-week abortion ban is way before viability. And I think one of the things we saw happening in the conversations around this ban being enacted yesterday is that people don't quite understand what weeks of abortion mean, weeks of pregnancy means. So 6 weeks pregnant means 6 weeks since your last menstrual period. So that means you are 2 weeks late. That is before most people know they are pregnant. So by the time you know you're pregnant, it's too late. You can no longer get an abortion in Texas. That is just devastating to people. It's not being covered as an overturning of Roe. The people I feel like are getting a little lost. I think advocates are doing their best to talk about what this is going to mean for people on the ground. But the media is already turning to the next political chess move, right? What are Democrats going to do? And that's important. But in that conversation, we also need to be talking about what this means for people, because people are why this is so important. It breaks my heart. I think it's just really hard to, it's just really hard to think about right now. I feel for all these people, and I know so many people don't know what to do and they want to take actions right now. So, I think some of the things that are at the moment helpful are speaking out, right? Making sure people know about this, making sure that people know what you feel and why you think this is important. Those are all really important. Making sure your congresspeople know that you think this is really important and that something needs to be done to ensure that people have the right to access abortion and the ability to access it, right? We've always talked about Roe being not enough, that we need things like the Hyde Amendment repealed so that people can afford to access abortion care. So it's not just that they can't get it, because there's a 6-week ban. Maybe they can't afford it too. So like all of this plays together. We also need to talk about who this is going to impact, right? So people who have money are going to be able to travel out of state and easily access the care they need. This is going to have a huge disproportionate impact on low-income people, Black and brown people, young people, the LGBTQ community. Like, these are the people who are going to see just terrible impacts from this heinous law. So make sure that you're lifting that up. The other really important thing right now is we always talk about the importance of donating to abortion funds. And right now, Texas abortion funds really need our support. So we'll make sure we include in the show notes a full list of Texas abortion funds, and we'll, share it out on social media as well. I'll try and shout out some of them here. I'm sure I won't get everybody, and I'm sorry, but we'll have the things on the website. So the Lilith Fund, the Texas Equal Access Fund, Jane's Due Process, the Whole Women's Health Alliance, the West Fund, the Clinic Access Support Network, the La Frontera Fund, the Buckle Bunnies Fund, the AFIA Center, the Bridge Collective, and Fund Texas Choice. So we'll have links to them on our website, and we'll definitely be sharing things on social. But, make sure you donate to abortion funds if you are able. That is something I have been doing in my rage. I have donated to a number of them. There is also a link going around where you can donate in one place, and it will be divided between, I think, 9 abortion funds. So that is also a great option. Do what you can. If you can't donate, that's fine. Make sure you're speaking out. It's kind of all hands on deck right now. I think, just do what you can. So I think that's kind of where I wanted to end. And maybe just one thing that I think lifted me up a little bit today. It was really devastating the way this all went down, with the Supreme Court doing nothing and letting it go into effect. And then the next day coming out with their opinions, where it was a 5-4 vote with 5 justices voting for it, allowing it to go into place, with Justice Roberts joining the liberals on the court to say that, whoa, we need to hold up and take a closer look at this. So one thing that really, I don't know if fired up is the right word, but really spoke to my anger a little bit this morning when we're recording, is reading the beginning of Justice Sotomayor's dissent. So I'm going to read a little bit of it here. Sorry, we're just going to read the first paragraph, but I think it's important. The court's order is stunning. Presented with an application to enjoin a flagrantly unconstitutional law engineered to prohibit women from exercising their constitutional rights and evade judicial scrutiny, a majority of justices have opted to bury their heads in the sand. Last night, the court silently acquiesced in a state's enactment of a law that flouts nearly 50 years of federal precedents. Today, the court belatedly explains that it declined to grant relief because of procedural complexities in the state's own invention. Because the court's failure to act rewards tactics designed to avoid judicial review and inflict significant harm on the applicants and on the women seeking abortions in Texas, I dissent. I just thought it was a really strong opening to her dissent, talking about how they're throwing out precedent and just this is so blatantly unconstitutional and that people are going to have real harm. It was really important. And I think it shows that there is a fight ahead. And, just always remember, this is not the end. It's the beginning. We're going to keep fighting until everyone is able to access the care they need, no matter their ability to afford it. We're going to keep fighting until everyone is able to access abortion care. Don't worry. The fight goes on. Today is a dark day, but the fight goes on. And with that, I know it's kind of a bleak start to the podcast, y'all, but like I said, I'm feeling rage and heartbreak still. So it needs to be out there. We will be covering what's happening in Texas more fully. Don't worry, we'll do an episode. I'm hoping an emergency episode next week that will dig into this. but there will be one soon that talks about it more. If you want to see more about the Texas law before it was enacted, you can go back 2 episodes in our feed and you'll see one where I talked to the amazing Jessica Mason-Piclo of Rewire News Group and Boom Lawyered, and hear us talking about the law and why it was so important before it went into place. You can also check out Boom Lawyered. They did an amazing episode dissecting this and why this is so terrible. So yeah, definitely check them out as well. But we will be doing one soon. And with that, let's turn to this week's interview. So switching gears a little bit, we're going to focus on a global issue instead of domestic. We are talking about the United Nations Population Fund, UNFPA. It was actually one of the very first episodes we did, and it's been a while since we've talked about UNFPA. So I wanted to make sure that we are talking about them. For one, they do really important work, but 2, they do really important work in humanitarian settings. And there's a lot of humanitarian crises happening right now. And so we wanted to talk about UNFPA's work in humanitarian crisis and some specific ones. So we talk about what UNFPA is doing right now in Afghanistan and Haiti. And so joining for me for that conversation is the wonderful Rachel Moynihan at UNFPA's DC office. So I hope you enjoy my conversation with Rachel. Hi, Rachel. Thank you so much for being here today.
It's a pleasure, Jenny. Thank you very much for having me.
So before we get started, do you want to take a quick second and introduce yourself and include your pronouns?
Absolutely. My name is Rachel Moynihan. My pronouns are she and her.
I am so excited to have you on. One of the very first episodes we did of the podcast, I actually talked to your boss, Sarah, all about UNFPA. But it's been a while since I've done a deep dive on UNFPA specifically versus having them come up tangentially on so many issues that y'all work on that we talk about those issues. Right now, it does feel like a really important time to talk about UNFPA, the work you all do, especially in humanitarian settings. There's a lot going on right now, and you all are involved in so many areas that are super important. So maybe we should start at the very beginning. And what is UNFPA?
Absolutely. So first of all, I couldn't agree more with your point, Jenny, that there is a lot going on in the world right now, and we're just delighted to be on here talking to you. And we were delighted to be one of your first and so happy to be back. So thank you again for speaking with us again. And just a quick intro to what UNFPA is. So UNFPA, the United Nations Population Fund, is the UN Sexual and Reproductive Health Agency. And we were founded just over 50 years ago with the leadership of the US government and a lot of other governments that came together around population issues. And today, our 3 goals are pretty simple. The first goal is to end the unmet need for voluntary family planning. Our second goal is to end preventable maternal deaths. And our third goal is to end gender-based violence. And within that frame, we consider things like child marriage or child early and forced marriage, and FGM, which is female genital mutilation. We consider those forms of gender-based violence. So those are harmful practices that we would also like to see ended. Those are our main 3 goals. We're very proud of our work. We're active in just over 150 countries and territories, including, as you mentioned earlier, as you alluded to earlier, in most of the humanitarian settings that you are reading about in the news today.
So I think that brings us to what work does UNFPA do in humanitarian settings? You talked about these really important goals you all work on, but I think when it comes to top of mind when people are thinking about humanitarian settings or crisis is like food, water, shelter. But UNFPA is really doing important work there as well.
No question. Totally agree with you there. The first things you think of when you think of a crisis is exactly what you said. It's getting food to people. It's getting water to people. It's getting shelter to people. But really, when you think about any crisis and you think about the things you see on the news, think about flipping through the news right now and you see some of the most heart-wrenching images on the news. What do you see? You think about images of young children, images of babies, images of maybe a pregnant woman, an expectant woman who's on her way from, who's fleeing from a humanitarian situation, whether it's man-made or natural. And she needs care too. So I will say that UNFPA's core work, meeting the needs of expectant women, meeting the needs of young people, meeting the safety needs of women and children, those are right up there with food, water, and shelter. And unfortunately, something that we've noticed is that those things are often the first featured and the last funded. They're the first featured on the news. They're the images that tug at your heartstring. They're the stories that really break your heart just from a human perspective. But when it comes to funding those or finding the political will to meet the needs, to meet the reproductive health needs specifically of women, to meet the safe delivery needs of expectant women, to meet the gender-based violence prevention complexity, of actually thinking about and planning for those things, oftentimes the political will dries up or the money has run out or that's considered an add-on. And I would just fundamentally disagree with that. So where UNFPA comes in, to answer your question, is on two fronts. Number one is gathering that political will, is being at the table, like I said, in 150 countries and territories and working with those governments or the leadership in power to say, you all should be funding this as well. This is in your own best interest to look out for the rights and for the protection of the women and girls in your own communities, because that's a measure of how well your society is going to do overall. When the parents of a child are fed and educated, their children are much more likely to be fed and educated. And that has positive ripples throughout your community, throughout your society, throughout your country. And then conversely, when those aren't met, that starts a downward spiral that's very hard to recover from. So that's the first place where we're at, is the sort of political area. And then the service delivery is what we do. We're on the ground. We are not just a normative agency, which is to say we don't just talk about these things. We talk about those things, but we actually do these things as well. So we as a UN agency are with our partners that most of our listeners have probably heard of. We're with the World Food Program and the World Health Organization and with UNICEF. And we pre-position supplies all over the world so that supplies can get to especially vulnerable areas in a very, very short period of time. Medical supplies that include things like menstruation products that, again, don't necessarily come top of mind, but are very essential when it comes to a woman being able to move and access humanitarian assistance and to remain clean and dignified. So we pre-position supplies. We are in countries before, during, and after a crisis. That's the reality. That's sort of the comparative advantage of being with the UN, is that we're often there before a crisis happens, we're there during and through the crisis, and we're there afterwards to help rebuild afterwards.
Yeah, I think that's so important. You're right. It's often the first pictures that are used during a crisis, but it's really important to think about people don't stop being pregnant just because there is a crisis. People are still delivering babies. And some of those other issues we work on, like gender-based violence or child marriage, they all tend to go up during humanitarian crises. So there is already a need there, and it can often grow.
That's exactly right. And that's something that we've seen, especially in light of, COVID, which is in the background of all of this. And, to think about these crises happening today, it's all in the background of COVID. It's in the background of increasing climate-related natural disasters that are just exacerbated and intensified with the intensive damage to the climate that we as the world have done. So increasing, hurricanes and earthquakes and things like that are all contributing to a real exacerbation of a crisis wherever it is. And you're exactly right, Jenny, when you say that these issues, the need only goes up during a crisis. So a really good example, we put out some research right when the COVID crisis started. I believe it was either in March or April 2020, when these movement restrictions began. And we thought to ourselves, what does that really mean for instance, somebody who is experiencing gender-based violence? When they are restricted movement out of their home, they may be kind of locked down with their abuser, for lack of a better word. There may be increased stress in the home because of layoffs, because of financial issues. And that's not unique to any one country, to any one socioeconomic class, to any one race or gender. That is universal. And so we put out a call very early on in the crisis to say, not only was the need there before, but it's only going to go up. And I would just add ditto with, girls being in school with shutdowns due to COVID. A school is often a girl's place to get food, obviously to get education, and in a lot of ways to be protected from harmful practices such as female genital mutilation and child early and forced marriage. So if she is no longer in school, which is, yes, it's a vehicle for education, but it's a vehicle for so much more, for her to pass through adolescence. safely and successfully, she doesn't have that protection measure. Those other issues of child marriage, of then you see pregnancy within marriage of younger girls are really children, and they're not prepared to be parents yet. And so you see maternal mortality rates then go up because they're not physically and mentally ready to be a parent. So it's very much, they're all interconnected, they're all related, which is why, going back to an earlier point, meeting the needs, sexual and reproductive health care needs are so essential in any crisis, right up there with food, water, and shelter.
Okay. So UNFPA is in a lot of humanitarian settings right now. And unfortunately, we don't have the time to talk about all of them. So let's focus on two of the big ones that have been in the news a lot lately. And let's start with Afghanistan. And I know UNFPA has been doing a lot of work there right now. So what kind of work is UNFPA doing in Afghanistan?
That's right, Jenny. Thank you for bringing that up. I think it's been heavy on our hearts these past couple of weeks to see, echoing the concern of the Secretary General when he said, really the rights of women, the rights of girls and women are a big question. It's a big question right now. And I think there's a real legitimate fear of return to very dark days for girls and women. But to answer your question, Jenny, we, again, as I mentioned before, we've been in Afghanistan for decades. We've been there before this crisis happened. We are there now. We are staying. We are delivering. And we'll be there after, whatever that looks like. So a solid example of that is back in 2018, UNFPA selected 35 young women from rural areas in the provinces of Ghor and Herat, and we trained them as community midwives. And the reason why we felt that was a priority in country is because Afghanistan has one of the highest maternal mortality rates in the world. Back in 2002, it was 1,600 women per 100,000 were dying in childbirth. That was the highest rate in the world, I believe. And now it's down to around 600.
That's amazing.
Which is still very high. And there's still work to be done there. But what progress has been made in the past 20 years there? And part of that progress is because of increased access to maternal care, to prenatal care, to safe delivery services. And so UNFPA, as I mentioned, back in 2018, started training midwives to go back to their communities. They completed a 2-year intensive training course. They went back to their communities to serve in rural areas. And they have been able to serve thousands of women in their community. They established what are called family health houses. They provide 24/7 basic emergency maternal health care. And in 2020 alone, nearly 5,000, so 4,943 pregnant women with no access to basic emergency care were able to access that as a direct result of UNFPA's work, of UNFPA's training. And I will say today, we have actually expanded the number of family health houses that are open in rural areas. And 171 of 172 of those centers are still open, are still operating. And I just want to give major kudos to our folks on the ground who are risking their lives every day to serve the women of Afghanistan.
Yeah, I think that's so important. I think it's often hard for people in the US to understand how hard it is to access maternal health care or health care, reproductive health care in some of these remote rural areas, particularly in a place like Afghanistan. Like there are places in the US where you may have to travel a long ways to get healthcare, but it's generally easier, right? You're going to have really well done roads. It's just a little different. And that's not to downplay the needs of access in the US because they are really important. But it is also generally a little bit easier to do that here versus somewhere like Afghanistan. So it's really important to focus on getting to these remote rural areas to make sure that people have access to the services they need.
That's exactly right. And I think, not just the midwife network that we have helped stand up and support, but also mobile health teams. To your point, Jenny, that it's, Afghanistan's a mountainous place. It's not an easy place. There's not necessarily an advanced interconnected highway system where people can just jump in a car and go an hour to the hospital. So a lot of times our teams have to go into their communities, into their villages. And so the importance of, again, being there before a crisis, the importance of being there before a crisis allows us to better serve during a crisis and then to most appropriately and better serve after a crisis is over. I think it really remains, I don't want to seem too Pollyanna-ish here because I think it really remains to be seen what is the future for those 35 midwives that we trained? We don't know. We've had assurances from folks that women will be allowed to work, but is that going to be the reality? We don't know. We hope that's the case. The Secretary General has made it very clear that that's what the expectation is, that there's unfettered humanitarian access, and that folks who we've worked with, not just UN staff, but all of the community health workers that we have trained, all of the great advocates in country, that they be allowed to continue their work. But I think there's a real legitimate fear that that won't be the case, and that remains to be seen. So the stakes are extremely high in the country. We've made progress in things, lowering the maternal mortality rate, but that's not an inevitable statistic. That is not an inevitable trend that can spike right back up again if we don't continue that work and continue the training of providers in country. So I have there's real fear. There's real fear.
I think that's a really important point. There has been so much progress made, but it doesn't mean that progress is given to continue or even go back. And there's a real worry right now about what's going to happen in Afghanistan, particularly for women and girls when it comes to access to services, but for so many other issues.
That's exactly right. And if I could implore your audience, if they haven't listened to your recent conversation with Gayatri Patel of the Women's Refugee Commission, she had, I think, a really great and frankly more broad understanding of what the real stakes were there. She had a really great insight into the status of journalists and academics and things like that I don't have as much visibility into, but I thought you two had a really great conversation about the broader outlook in Afghanistan. So I would encourage your listeners to go back and listen to that if they haven't already.
Oh, yeah, thanks. Gayatri is always wonderful to talk to. And it was really great to get that broader view of what's happening in Afghanistan and what that's going to mean, particularly for women and girls. And I think it was a great setup for this conversation then, where we can dive more deeply into the reproductive health and the maternal health needs in Afghanistan. But I think it's so important to talk about both.
Yes, totally agree with you. And I think they're related, as we talked about. It's all related. If a girl doesn't pass safely through her adolescence, then she can't then go on to be that journalist. She can't then go on to be that politician who is at the table in the peace negotiations with the Taliban. So I think the line between an educated and healthy girl to an educated and healthy full adult in her society it's direct. It's a direct line. So thank you for that.
Okay, so after Afghanistan, the next big thing that was in the news unfortunately got really overshadowed because of the humanitarian crisis in Afghanistan, because they kind of happened right around the same time, and that's the earthquake in Haiti. So maybe can you tell us a little bit about what is happening in Haiti and what UNFPA is doing?
Absolutely. Thanks again, Jenny, for bringing this up. You're totally right, and I feel like it has been overshadowed by so many other things that are going on both domestically in the United States and internationally. It's pretty unbelievable. But yes, I'm sure your listeners, most of them know this, but on August 14th, there was a 7.2 magnitude earthquake that struck Haiti on the same fault line as that dramatic earthquake 10 years ago that really devastated the country. And
I feel so bad.
Again, as most of your listeners will know, this is in a backdrop of COVID that is ravaging the country. It is in the shadow of a presidential assassination. President Jovenel Moïse was very recently assassinated in that country. So you're also dealing with a lot of political instability and already a health crisis, food insecurity, gang violence. And then you have this absolutely devastating earthquake, literally along the same fault line as this last one, as the last major earthquake in the country. So you have a compounding crisis in the country that is not easy and already comes with a baseline of challenges. So once again, UNFPA was already there. We've been in the country for decades. We are there now. We have pre-positioned supplies because of the known risk of both hurricane season. It's also hurricane season. The known risk of hurricanes, the known risk of earthquakes. We have pre-positioned supplies in the region, in the country. So we were able to rush supplies to a number of people there. But look, you're dealing with destroyed hospitals, destroyed health facilities, buildings that have literally crumbled. You have more than 2,000 people reported to have been killed, more than 10,000 injured. And that's at a baseline when hospitals and clinics have crumbled. And so We have at least 24 health facilities that have been either damaged or completely destroyed that UNFPA has been working in. We are very concerned that not just health facilities are damaged, but also, of course, people's homes. Homes are destroyed. And so you have homelessness and you have a very vulnerable situation, especially for younger people and for women who are unhoused right now in Haiti. I think it's a real problem. So right now, UNFPA is strengthening capacity. We have surged our people to 40 different health facilities. We've set up mobile teams for people who are out of their homes and who are not able to access traditional hospitals. We have reproductive health kits that are there with medical and non-medical supplies, maternal health medicines, contraception, menstrual health supplies too, for people to maintain their dignity and their cleanliness, because again, people don't stop menstruating, people don't stop being pregnant just because an earthquake has struck one's home. And it's estimated that 22,000 women are going to give birth in the next 3 months. And of those 22,000 people, 3,700 of them will likely require cesarean help, which of course is a much more advanced intervention that is needed. So we're working very closely with the current Haitian government. We're part of the broader UN activities there to meet everything as basic from providing menstrual pads and clean underwear and soap to people to literally dropping hospitaners in the middle of the country that can provide those needed cesarean sections in the absence of traditional health facilities that have been damaged or crumbled. So again, just incredibly proud of our team's work in a very complex situation there, and we will continue to stay and deliver.
I'm just really glad that we were able to talk about this, because I really do feel like the crisis in Haiti has been a bit like a forgotten crisis right now. It's just been overshadowed by so much between Afghanistan and many things happening in the States. It's good to remind people that this is still happening and still a humanitarian crisis. And two, get to hear about the amazing work that UNFPA is doing.
Thank you, Jenny. And I'll just mention that one of the roles that UNFPA plays in the broader humanitarian settings, including here in Haiti and also in our conversation of Afghanistan, is because we have access to supply chains and humanitarian corridors and airplanes and logistical capacities, we are able to not just supply UNFPA or other health, UN-supported health facilities, but really to support the health facilities that are run by governments and NGOs and community workers. 70% of UNFPA's funding and money in any country goes to local organizations and local communities, because the work that we're working on is incredibly intimate. It's incredibly personal. We rely on and partner with local communities who know what their folks need. So I just wanted to mention that it's not just, anonymous UN person storming into a country, suddenly upon the onset of a crisis. It's people who have been locally hired. It's Haitians in Haiti with support of the UN, but tapping into those supply chains. It's Afghans in Afghanistan who have been hired, but who are of the community in their own communities. And we're working with the most respected faith-based organizations and NGOs on the ground. Something that we're really proud of the model of how we work.
Okay, now that we know about the great work that UNFPA is doing, what can the U.S. do to support UNFPA? I know the past 4 years have been really dark, particularly in terms of support for UNFPA. So it's really important to talk about the ways the U.S. can support them and also rebuild some of the damage that was done.
Yes, thank you for bringing this up. Yeah, we really regretted that the Trump administration didn't support UNFPA either politically or financially. They pulled all support from UNFPA and made no exemption for our humanitarian work, especially amid the COVID-19 crisis. So we were really delighted when the Biden-Harris administration included funding and support for UNFPA in its platform and really made good on that intention the moment they took office. So we're really proud to say that we have received funding from the United States in a number of different places, including in Afghanistan and I believe also in Haiti. Don't quote me on that if it's wrong, but the U.S. has been back in a big way, both politically and financially. So we're really grateful for that. And, folks can express their appreciation to the administration and for their members of Congress, for those who have supported us, because our work is tough. It's a tough mandate sometimes, but it is so critical that there is a voice speaking for reproductive health and rights around the world, even amid a crisis, and especially, I would argue, amid a crisis. So we're really delighted that the administration is back. We need the help of civil society partners. We couldn't do it without them. We couldn't do it without NGOs. We couldn't do it without you all, without folks who are advocating for the rights of women and girls and all people, really, not just women and girls, but for all people to realize their sexual and reproductive health and rights and to support UNFPA's work. We're so appreciative of that.
I think that leads us to my favorite question. We have an audience that loves to take action. What can our audience do?
Yes. So, again, harkening back to the earlier conversation, the core of UNFPA's work is so often first featured and last funded. When you look at news coverage of any crisis and you see a pregnant woman or you see a baby or you see children fleeing from their school or from their community, you turn around and then you ask for political and financial support to then support that expectant mother or that teen girl who is hoping to finish up her school, without becoming a bride or a mother before she's ready, or to that person who is fleeing a home that is violent. Suddenly that political support and that financial support will dry up. So my ask for your listeners, which is somewhat similar to what, again, Gayatri, to call back to the last episode, call your member of Congress. And if they are supportive of UNFPA's work and the work broadly, it doesn't necessarily have to be done by UNFPA, but the work more broadly on behalf of sexual and reproductive health and rights, call them and thank them. And it's not just in a crisis that it needs to happen. I know there's a lot happening in the U.S. domestically this week, but when it happens here, it's happening all over the world. There are versions of this that are happening all over the world. And those rights and those choices must be protected and fiercely defended. And, where we can ask for support, we would appreciate that. And our sister organization, Friends of UNFPA, friendsofUNFPA.org, they are constantly doing fundraising on behalf of UNFPA and allowing you to channel that political support for UNFPA if you are so interested. And we would be very grateful for your support. Thank you.
Well, Rachel, as always, it was delightful to get to talk to you. Thank you so much for being here and letting everyone know about the wonderful work that UNFPA is doing.
We really appreciate being able to be on here, Jenny. Thank you for your time. Thank you for inviting us. And thank you for all you and your listeners are doing every day. Really appreciate it. Take care.
Okay, y'all. I hope you enjoyed my conversation with Rachel. And just remember, we are in this fight for the long haul. I know we're all exhausted and heartbroken and feeling so much rage, but we will keep fighting. And we will be doing an episode soon. Don't worry, talking about what happened in Texas. If you have questions that you would like to make sure we talk about in that episode, please feel free to shoot me an email at jenny@reprosfightback.com. Or you can reach out to us on social media at rePROs Fight Back on Facebook and Twitter, or rePROs FB on Instagram. And I will make sure to include those questions in the conversation I have about the Texas law. Otherwise, I will see you all soon and just keep fighting. For more information, including show notes from this episode and previous episodes, please visit us at our website at reprosfightback.com. You can also find us on Facebook and Twitter at rePROs Fight Back and on Instagram at rePROs FB. If you like our show, please help others find it by sharing it with your friends, and please rate and review us on Apple Podcasts. Thanks for listening.